wash my hands, introduce myself to the patient, identify them with their name and date of birth. I'm going to explain what we're going to, provide privacy. I'm going to explain that we're going to insert a Foley catheter, because they've been retaining urine. And then I'm going to raise the bed to working height and make sure that my bed and my table, oh, my jacket, good call. That my bed and my table are at the same height. So I'm right-handed, so I'm going to be on the right side of the bed.
You didn't put that up or?
No, I'm okay. As long as I got this. I'm going to position the patient appropriately, so they're going to be in a dorsal recumbent position. I'm going to drape them, so make sure they're obviously going to have a gown on, so you can put their gown up here, and then cover them, their legs down here with their sheet, just only exposing the perineum. So we're doing a female today. So I'm gonna expose them so you can all see. Drape them, and then we're gonna prepare our sterile field.
So I have all families step out during this time. I don't care if it's significant other, I still ask, you know what? Go take a walk around the block, go get some fresh air, there's no really need for you that way. And what's she walking in first with? How many kids has she got?
2.
My other one is sitting over there on the chair, and then my trash can is gonna be the floor. Okay? So this is a good way to practice opening all the different sterile things. So we're gonna open away from us. We're gonna do the left, the right, and then the back flap towards us. Okay, so remember all of this is sterile, besides the 1-inch border, okay? So you can, once you put your gloves on, you can touch whatever you'd like in the kit. So it says to place a waterproof pad underneath them. They're gonna have a chucks pad underneath them as well. There is one in the kit, so a lot of people get confused that you have sterile gloves on and then you're tucking something underneath the patient. So if you feel that you're at risk for contamination, just don't use it, okay? But it is available if you want it. So I'm gonna take my gloves. Normally I'd have a bigger table. The tables at the hospital are a little bit bigger. I wouldn't touch my sterile field with this. Okay, now that my gloves are on, back I go. I'm gonna move this back into the center. This is the waterproof pad that you can use. Again, I'm just, especially if it's a bigger patient or they're trying to move around and you don't have help, you risk breaking your sterile field. So they already have a chucks underneath them. I can clean them up afterwards. So I drop that. Yep, so this is the drape. This will look the same for male or female. So you're going to want to drape the area. This will also help kind of your mess. So then I'm going to set up my kit so that everything is in order. So these come apart. So you can set them next to each other because I'm not near the 1-inch border. You drape the patient. Okay. So then you're either going to have alcohol swabs or sometimes there's a packet of solution with cotton balls that you have to pour over it. Your checkoff sheet specifically says open antiseptic solution and pour over cotton balls. And then there's probably going to be forceps. For this kit, there's just alcohol swabs. So I would open my alcohol swabs. I like to open it so that this is showing so that I can just grab them out of the kit. I like to lay them like that. Then you're going to open your lube. There's a nice little, I'll hold it up for you so you guys can see. This little tray right here is where you pour your lube so you can dip your catheter into it. So I'm gonna pretend like I'm pouring it in because I don't want to use lube on the mannequin. So when we lubricate the catheter, we're gonna lubricate 1 to 2 inches. So this is the catheter, this is perforated. So you can tear it. Some people just wanna like rip it out of this. Well, what happens is it ends up flopping and it flops outside your sterile field onto your table. So use this to your advantage. And you can touch this because it hasn't gone on the patient, so that way that you have control over the catheter, because it's very flimsy. So I would take this, I kind of unwind it, and I place it in my loop here, 1 to 2 inches of lubrication. Sorry, I'm just making sure I'm going over it the correct way. Okay, then you've got your pre-filled syringe. This is gonna be for the balloon that's gonna hold that catheter in place, okay? So you're gonna take this, cap off, and you're going to hook it to the port. Okay, you're gonna do this before it goes into the patient. So essentially, you've got everything ready to go before you even touch the patient, okay? Again, I make sure everything's kind of organized, so that I don't risk breaking sterility.
What's on your floor?
It's one of the things from when I ripped it off.
Okay.
Okay. Oh, one thing, that a lot of people don't do is you need to make sure that your balloon works. So, you're gonna squeeze that syringe and make sure the balloon actually blows up. Because the worst part is if you stick it in your patient and then it doesn't actually open up. As long as this is attached, you see how it goes right back into the syringe? So as long as the syringe is attached, your balloon will deflate. So, I'll show you how to remove it, but you wanna make sure you take your syringe off when you're ready, when you're done inserting. Okay. So, now I'm ready to clean. So now I'm gonna have my non-dominant hand is going to be non-sterile. It's gonna be your clean hand. So what we're going to do is we're going to spread the labia apart so it's nice and open, and we're gonna clean farthest away, closest, and middle of the labia, okay? And usually there's 3 cotton balls or 3 swabs, so you've got 1 for each, okay? So I'm going to, now that I have everything set up, spread the labia, take each swab away. Closest. And.
Jen, is that already dipped in solution?
Mhm.
Okay, just.
Yep. Okay. Yep, okay. So, picking up our catheter with our sterile hand, it's already lubricated, okay? This is the tricky part. You can always move this closer too. I think we'll try and insert it to the actual urethra, but some of these catheters are too big for the mannequin, so you may actually have to insert it in another hole, but go in the right hole. So we're gonna pick up the catheter. We're going to start inserting it. We're gonna tell the patient that we want them to like bear down. It's gonna be a little uncomfortable. Always talk them through it. If they've never had a catheter, this is like embarrassing, traumatizing, so you just wanna make sure that we walk them through it. Another thing that I forgot to mention is those swabs. Some of them are iodine. If the patient, you need to make sure the patient is not allergic to iodine. The worst thing that you could do is use iodine swabs on an allergic patient, and then that is not fine. So, what?
As well as up, you can't see the
Yeah, so, yeah, make sure that. So patient's bearing down, we're inserting the catheter, again, only touching the hole. And we're going to, sorry, this is hard, because 12 inch is definitely better.
Does it work?
It's hard, but I get it. It's going, yeah, it's going.
Okay.
Okay, so we are going to keep inserting it until we see urine. You will see urine come through the tube. Once you see urine, you're gonna wanna insert it an extra 1 to 2 inches. Okay? We're gonna, for time purposes and because this is difficult, we're going to, I've inserted it 1 to 2 inches, okay? So, I'm going to take my clean hand here and inflate my balloon. Now my catheter's in, the procedure is technically done, so I can use this, and I wanna remove this right away, because what's gonna happen is if you don't remove it, it's gonna fill back up with fluid and your catheter's gonna start coming out, okay? Then you wanna gently, I don't know if it says this in here. Yes, resistance is met. So you just kinda wanna, don't hug, but just kind of pull just slightly so that you know that the balloon is actually in place. Okay? So now your insertion's done, you don't need to be sterile anymore. So we want to make sure that, this is all unkinked. We're gonna attach it to a non-movable surface. We're also gonna make sure that we've got our securement device. So this is where the securement device would be, and it would go on the inside of the thigh, okay? You don't want it too close to their peri area because then this tubing is all kinked. So you want it to be able to be at least free flow through. Tug on catheter. We just want to, again, note the urine. We want to look for any sediment. You shouldn't be able to smell anything in the catheter, but you can smell at the site. So if anything is of concern, that's something that you want to notify the provider about. You would then clean up all of your stuff. I usually do nice peri care and catheter care. So since we're going to do that, we'll just go straight into that. That's part of your checkoff as well.